In this video, I would like to explain why so many people suffer from lower back pain. Hi, it's me again, Gary Kaufman, certified neuromuscular therapist, specialized in the strain counter-strain technique, practicing in Santa Monica, California. Thank you for watching my last 3 videos, and if you did not, you might want to, because it will help you to understand this video. As you heard before, bones cannot move. They are pulled by the muscles. Muscles do not decide if they need to contract, stretch, or lock into contraction, a spasm. They receive electric signal from the autonomic nervous system, which uses information it receives from the muscle to determine what state the muscle should be in. Once the muscles are in spasm, they would completely change the biomechanics of the body. This is especially true for the hip flexors, the iliopsoas muscles. One side of this muscle is on the right side of the spine, and the other on the left. These muscles connect to the side and the front of the spine, not to the back, passing through the pelvis and attaching at the upper leg. Usually, the right hip flexor are used more than the left, because most of us are right-handed and drive automatic cars, using the right leg more than the left. When the right iliopsoas muscles are in spasm, they would produce these 3 major effects. First, they will rotate the spine to the left and pull it laterally to the right. Next, they will compress the sacroiliac joint, which is in the back, and the thigh into the hip socket. Finally, they will rotate the right hip forward more than the left, which changes the body's center of gravity and forces the nervous system to contract different muscles excessively in its attempt to keep the eyes level. These muscles also tend to send referred diffuse pain to the lower back area, so it could be confusing because the pain is felt in the lower back, but the cause is in the front. The hips have to be level because they carry the body's center of gravity. When you lie on your back and your right hip is rotated forward, it will push the leg on that side down, making it effectively longer, and the left leg effectively shorter. When you stand, your body will be shifted toward the shorter leg, which will cause the hip and the spine to shift to the left, and will trigger the righting reflex of the nervous system, in which it attempts to keep the eyes level. In its attempt to keep the eyes level, the nervous system will contract the right muscles above the right hip with the right spinal muscles to shift the spine to the right, and the muscle between the left shoulder and the head to lift the left shoulder to level the eyes. All this excessive muscle activity will create more muscle spasm. If you start watching people, you will see there usually right hip is higher than the left, and left shoulder is higher than the right. This is just a reflection of the attempt of the nervous system to keep the eyes level, and it's being done every second all day long, standing, sitting, or walking. It is similar to driving a car with a flat tire. The car will swerve to the side of the flat tire, and you will turn the wheel to the opposite side, towards the center. This is exactly what the nervous system does every second once you sit, stand, or walk, in its attempt to keep the eyes level and prevent you getting dizzy. When functioning with unlevel hips, any additional physical or sport activity will accelerate the dysfunction and hasten the appearance of the symptoms. This is what will happen too if you accelerate your car with a flat tire rather than slow it down. Another interesting mechanism will happen in the body once the hip flexors are in spasm. This spastic muscle will get weaker not because lack of use, but because they got shorter and shorter. As a result of this, the distance between the two ends of the muscle will get smaller. The smaller the distance is, the weaker the muscle contraction will be. When you walk, these muscles will not be able to raise your legs as effectively as they are supposed to, so the nervous system will engage the side muscle of the hip and the spinal muscle themselves to compensate for the hip flexor's weakness in its attempt to propel the leg forward. This is why we should not treat first the symptoms, the compensating muscles, but the cause, the hip flexors. In my book, I show you how to quickly and effectively release spasm in these muscles and other muscles and relieve your lower back pain. What is unique about this book is that it will teach you step by step how to do this without any pain or discomfort. With this book, you will start to deal with the cause of your lower back pain and not just treat the symptoms. Using the technique detailed in this book, you will follow the structure of your nervous system to correct the biomechanics of your body instead of chasing your pain. With this specific technique, called strain counter strain or positional release, in addition to releasing the muscle spasm, you will calm down your nervous system because you will switch its mode from fight or flight to relaxation. Ultimately, by practicing the technique explained in my book, you could take back control of your lower back pain and no longer feel helpless and mystified. Buy this book, practice this technique, and start expanding your safety zone, the ability to do things you miss, and enjoy life free of lower back pain. Thank you again for watching this video, and I hope it helped you to clear the fog and mystery surrounding the so common lower back pain.